This is my presentation on the profession of being a physical therapist. The education you need. You need to earn a Doctor of Physical Therapy degree from a commission on accreditation in physical therapy education, accredited physical therapist education program, and pass a state licensure exam. You also need to obtain a bachelor's degree for exercise science and then attend a graduate school. Graduate schools will require a certain amount of shadowing hours to attend them. Other certifications required, such as CPR and first aid training. Okay, so characteristics. Some characteristics you need for this profession include being compassionate and empathetic, having confidence and resilience, good communication, being able to, talk to your patients, stuff like that, flexibility and adaptability, physical fitness, and health consciousness. I feel like that's a big one, is just having these certain characteristics, because you don't want to be, I don't want to say boring, but you don't want to, not sound like you're not happy to be there. I feel like if you're helping someone trying to recover, you should make it as positive and as fun as possible for them, because, I feel like someone going through that and having to recover from an injury or a disease, they're probably already having a hard enough time. Most physical therapists work from Monday to Friday. This is kind of a normal schedule, I'd say. The lifestyle includes patient assessments, collaborative meetings, and many other things. The clientele that physical therapists usually work with are people who have experienced an injury or a disease that has affected their movement and range of motion. Next is the reinforcement I got through taking this course for this profession. This course actually helped me with this path due to learning more about all the other paths in general. I didn't really know what this class was going to be about when I first took it, and it kind of shocked me in a good way, because I don't know, the name of it kind of threw me off. I didn't think that's what it was going to be about, but I did enjoy the course. I came into the course thinking about all the different professions in the field of study. Throughout the semester, this course helped me understand the pros and cons of each profession more clearly. There were some things to different professions that I didn't understand or I didn't know yet, and this course kind of helped me figure those out and learn those new things. Okay, so job outlook and demand. The demand in these days is very high for physical therapists. Available jobs are expected to grow by 15 to 41% over the next 10 years. The U.S. will need over 60,000 physical therapists by 2032 due to the increased demand and retirement of existing physical therapists. These stats actually kind of shocked me, because I wasn't really expecting the job availability to really be that much, but I guess it is. Okay, I kind of added this slide in, but I felt like it was important for explaining my reason for wanting to do this career. So, whenever I was in 8th grade playing basketball, I hurt my knee and I had to get surgery. I tore my growth plate from my patella, so I had to get surgery, get that fixed and everything, and then I had to recover, so I had to go through physical therapy. Well, my physical therapist made it fun, made it positive, and I just had a good experience recovering and being able to play basketball again, and it was just a really good time. And I felt like that would be something I would love to do as a job, is just help people, help athletes, just people recovering and getting back to what they love doing. Okay, so before I wrap up this presentation, I'd like to come back to the education slide and talk about it a little bit more. Kind of just stress the fact that it is a lot of schooling that you have to get through, and that comes with, cost, time, all that kind of stuff. And I just wanted to talk about how I think physical therapy as a profession is one of the harder professions in this study, the study of exercise science. It's really one of the harder fields to get into. You know, a lot of people, they will go get their bachelor's degree, and a lot of other options are out there right after your bachelor's degree with exercise science, but physical therapy is one of those ones where you just have to attend a grad school to get into, and that might turn a lot of people away. But yeah, I just wanted to come back and really touch up on that fact. But yeah. Okay, so this is my conclusion and some key points to take away from this presentation. I believe it's a lot of hard work and determination involved with getting through graduate school and becoming a physical therapist. You know, most people, they get through college, they just want the bachelor's degree so they can move on and get into the workforce and stuff like that. But with being a physical therapist, you have to, you know, attend a graduate school, attend even more school, and you have to get through it and just stay determined and, you know, really hope you can help push yourself through it. You need to have certain characteristics that fit the profession. Like I said earlier in the presentation, you don't want to be boring. You want to get the people excited, your patients excited to be able, you know, they want to have a positive outlook on being able to recover and get back to what they love doing. So you need to provide that positive outlook by staying positive, staying up, not acting like you don't want to be there. There's going to be a lot of available jobs over the next 10 years for physical therapists. I believe this is a very good sign to get into this kind of profession, especially if you have the passion for it. And I think with a lot of hard work, determination, sticking through school, I think most people can really make it happen. That is my presentation on being a physical therapist.